Hello there, today we're diving into a topic that affects many of us, muscle cramps. These sudden involuntary contractions of a muscle group can be incredibly painful and disruptive. Let's talk about what causes them, how to treat and prevent them, and most importantly, I will tell you an amazing way of resolving your cramps mid-crisis using an ingredient you probably already have around at your home. But first, what are muscle cramps? Muscle cramps can really ruin your day and night. They are sudden involuntary contractions of a muscle group that are usually quite painful. Typically, they subside within 10 minutes, but they occur repeatedly, especially at night. They can disrupt your sleep and cause fatigue during daytime. These cramps can leave you with lingering pain and numbness on the affected limb, often in the legs. While they usually don't signal any serious health issues, they can significantly impact your quality of life. Imagine being jolted awake in the middle of the night by a searing pain in your leg. The muscle feels rock hard and you can't move it. You might even gasp or shout in pain. This is what many people experience with nighttime muscle cramps. And the worst part, it happens again and again and again. Every night, night after night. Now, who gets leg cramps? Well, it can happen to anyone, from children to the elderly. What is true is that it's going to increase with age, especially in your 50s and 60s, because physiological changes begin to occur amongst your musculature. Muscle atrophy begins to increase with the tendons shortening, which predisposes you to these types of problems. In addition, the older a person is, the more iron deficiencies he or she has, which can predispose you to muscle cramps. Then it happens in people who have a lot of physical activity too, which can be for work reasons or for sporting reasons. This type of person could also experience cramps. And not only that, but it also happens in pregnant women. It may be partly due to physiological changes and partly due to the overweight that occurs during pregnancy, especially as the pregnancy progresses. Well, which muscle groups are most frequently affected? Muscular cramps most commonly affect the legs, especially the calves, but they can also occur in the feet, the thighs, the hands, the arms, and the back, and also on the pectoral muscles. The specific muscle involved often depends on the type of physical activity and the strain that is experienced. Well, what is the cause of these muscle cramps? Well, first, we already talked about aging, which causes changes at the level of the musculature, but also shortens your tendons, especially in the legs, and can predispose to these types of cramps. On the other hand, we have also muscle fatigue that we have mentioned, which is related to excessive physical activity. For example, you can also have muscle cramps due to a long period of standing. It can be for work reasons or for whatever other reason you were standing for a long period of time. This also predisposes you to nighttime cramps, so your cramp might not be during day, but it might come at night when you were trying to rest. Sitting for a long period of time or a sedentary lifestyle is therefore also predisposing to muscle cramps, especially in postures like the cross-legging, the short and the calf tendons, which is where the muscle cramp occurs more frequently. Muscle cramps can also happen due to stress. Stress has been linked to muscle cramps as assortment of time. Studies show that the continuous amount of stress you're facing daily due to maybe a job you don't like, maybe you're dealing with people that are complicated, all of these leads to an inability to relax your body and relax your muscles, which can lead to muscle cramps, especially during nighttime. We also have dehydration and iron deficiencies. Not drinking enough fluids and having low levels of minerals like calcium, magnesium, and potassium can cause cramps. Even mild dehydration can disrupt the balance of electrolytes in your body, leading to cramps. And this is particularly relevant for older adults. A part of physiological changes that might already be present due to aging that predispose to muscle cramps, there are nutritional problems in the sense that as we get older, the person might not be drinking enough water and might have alterations in the blood minerals that predispose to even more cramps than normal. Now, what diseases can cause muscle cramps? There are many diseases that can cause or aggravate this type of problem. They can be cardiovascular, such as peripheral vascular disease, that occurs due to atherosclerosis that causes less blood to reach the legs and generate muscle cramps when the legs are under moderate to heavy use, like when you are walking too much, maybe going through a flight of stairs. There are also respiratory problems, metabolic problems, muscular, neurological, and even a mixture of all of these problems. Now, here's an example. You could have, for example, a herniated disc that presses on your spine and results in a myriad of symptoms that on some occasions can lead to cramps. That is to say, there are a number of diseases that could contribute to this. Now, why do muscle cramps occur more frequently at night time? Well, it is attributed to the posture we adopt at night. We relax, our feet are stretched, adopting a more horizontal position, and the Achilles tendons shorten, which are the tendons that come from the calf muscles, which are the muscles that have more muscle cramps than normal. This shortening is what predisposes to more frequent muscle cramps, especially in these postures, especially if you're wearing clothes that are restrictive and are pressing on top of your body, forcing one position to be maintained all night. Now, the problem here is that this is not the only cause, since, as we discussed above, there are many additional factors that could be involved. Now, don't worry, because later in the video I will give you practical solutions to this, so don't miss out, keep watching till the end. Now first let's answer, can you be affected by medication? Could your medication, the medication you're taking daily to help your health, cause muscle cramps? Well, yes. For example, diuretics used to lower blood pressure, sometimes even to treat heart failure, may lead to alterations in your kidneys that predispose to muscle cramps. Also, other antihypertensives, such as ACE inhibitors like enalapril or ARBs, such as losartan, can lead to changes in potassium and could predispose to muscle cramps. Then, we have also the statins, which are used to lower cholesterol and can cause muscle cramps, although it's more common for people to complain of muscle aches rather than cramps. There are also bronchodilators such as salbutamol, formoterol, salmeterol, and others, which can also give rise to problems of this type. Now, even oral contraceptives have also been related to be causing muscle cramps, so watch out. Now, you might be thinking, what is the difference between cramps and restless leg syndrome? Muscle cramps can also occur at night. What happens is that restless leg syndrome gives rise to more tingling and an unpleasant sensation of numbness that subsides with the movement. That's why we call it restless legs, because it involves being in motion, but it's not usually associated with pain. On the other hand, muscle cramp is a sudden spasm in your musculature and it hurts sharply too. Now, when is it necessary to consult a physician? Well, in this case, it's very much common sense. If you find that you have been having more and more cramps and they are becoming more frequent and more persistent and even more painful and start to interfere with your daily life, and even you have other symptoms such as muscle atrophy, muscle weakness, skin changes, you should consult a physician. You also should consult a physician if you notice that the cramps are associated with a medication you are taking, so that the doctor can try to replace this medication with something that is just as effective as the medication but with less side effects. Now, what can we do to stop a muscle cramp? Well, this is the important part of the video, the part where I tell you how to fix your muscle cramp when it starts abruptly, accompanied by pain. First, you need to consume half to 1 tablespoon of pickle juice. Pickle juice contains electrolytes like sodium in an enormous quantity and smaller amounts of potassium and magnesium. It's advisable to opt for vinegar-based pickle juice without added substances. Some studies suggest that a small amount of pickle juice can quickly relieve cramps due to a neural reflex triggered by its acidic taste, rather than through direct replenishment of electrolytes. However, more research is needed to fully understand its effectiveness and if the electrolytes come into play. If you frequently experience cramps, it might be worth trying pickle juice in moderation to see if it offers relief. If it doesn't help 100%, you can also try massaging the area and try to keep your arm, your leg, or even your foot as straight as possible in order to pull this muscle and keep it from cramping. But you gotta do this slowly and calmly in order not to increase your pain even more. You go and do it slowly, massaging your leg and trying to massage your cramp so that it goes away. If you do these 2 steps, I guarantee you, you will get rid of your muscle cramp. Now, what is recommended to prevent muscle cramps? We already know how to make them go away, but we need to prevent them. You can't be taking pickle juice for the rest of your life, right? Well, before going to sleep, you need to do stretches, stretching exercises. Specifically, we're talking about the feet, which is where the cramps occur more frequently. But it can happen in any muscle group, so you need to figure out which muscle group is affected and try to stretch that muscle before going to sleep. You can also apply local heat or massage the muscle in the form of a rotation. You do this slowly and surely you will be better. In this case of physical exercise, it's always recommended to stretch and warm up before exercising, so you don't get a risk of having a muscle cramp in the middle of your exercise. For hydration, drinking enough liquids and sometimes using sport drinks with electrolytes or minerals can be useful. Regular physical activity benefits overall health and helps prevent muscle cramps. Avoiding alcohol, tobacco, which can predispose to dehydration and cramps, is also advised. Now, is there any type of supplemental medication that can be given to treat or prevent muscle cramps? Different types of medications have been used, sometimes like muscle relaxants, drugs like gabapentin, calcium antagonists like diltiazem, verapamil, and vitamin B12 supplements. Supplements with magnesium, manganese, potassium, and calcium can also have a beneficial effect if you are deficient. A balanced diet and a multivitamin and multimineral supplements can also help. Isotonic drinks are sometimes also useful for athletes. Also, some people ask me, can surgery be performed to cure muscle cramps? The answer is no. It doesn't make much sense because usually the causes do not have a surgical solution unless they are related to nerve compression or vascular problems that can be solved with surgical intervention. These cases usually go with other symptoms along with the cramps. So if you only have cramps, you probably don't need surgery, okay? Muscle cramps can be painful and disruptive, but with the right measures I talked about, you can reduce their frequency and severity. If you got this far into the video, remember to like the video. Your like can help save lives by boosting the algorithm to recommend this channel. Subscribe and stay tuned for more health tips and advice on your next video. I thank you very much for watching, and bye bye.